Hi, I'm Ray Didinger, and I'm here today with Dr. Ben Chu, an orthopedic surgeon from Abington Health, and we're going to talk about knees. And so, doctor, what is the ACL?
The ACL, or anterior cruciate ligament, is a structure that connects the end of the thigh bone with the top of the shin bone. It helps prevent one bone from shifting relative to the other.
What exactly is involved when someone tears the ACL?
Well, Ray, when somebody tears the ACL, usually the knee buckles and one bone shifts too far, and that stretches the ligament. It can only stretch so far, and at a certain point, it can actually tear.
Are some people more prone to this kind of injury than others?
ACL tears can happen to anybody. It happens mostly with pivoting, twisting, jumping sports. But a lot of research has been done recently into the risk factors that might cause ACLs to tear more. A lot of the current research suggests that women tend to have a higher rate of tearing their ACLs compared to men, and there's multiple factors that play into that higher risk.
So what are you doing at Abington Orthopedic and Spine Institute to help people overcome these kinds of injuries?
At the Abington Orthopedic and Spine Institute, we're performing the cutting-edge techniques in ACL surgery. We're reconstructing the ACL with minimally invasive procedures and providing the best and quickest recovery. It's a team approach as well, so in addition to the surgery, we're also getting patients plugged into the proper therapy to appropriately rehab their knees after surgery.
Is there a risk of re-injury, or do people sort of have to avoid these kinds of activities for the rest of their lives?
That's a great question, Ray. The risk of re-injury is no different than anybody else. The goal of the surgery is to restore the normal function and stability that they started with their normal ACL. So if we do the surgery well and then do the appropriate rehab afterwards, the risk of a patient re-injuring their ACL is no different than anybody else with their normal ACL.
Well, thank you very much, doctor. And this is Ray Didinger, and for more information, visit abingtonhealth.org/bone.